All right, in today's episode, we're going to be talking about a topic that came up in dental nachos. If you're not in that group, go check it out. Paul Goodman runs it. He's an amazing doctor, amazing guy, and runs a really good group. And Tom Orton posted a comment in there. And here's what he said. He said, patient needs 4 crowns, has Delta. You'd lose $800 doing them in network. What do you do? What do you do? So we're going to talk about that today. I laid out an exact roadmap of what I would do, and I think it would be helpful. And I got a resource for you at the end. So here's exactly what I laid out. There's 5 steps that I would do if I was a doctor in that position. Because it's very interesting. When I first got into dental, I remember when Delta Dental was like the premier insurance. Like all the offices we worked with, for the most part, were fee for service. But a lot of them just kept Delta because it was better. Now, in a lot of states, Delta Dental reimburses less than Medicaid. So you're better off being in a state insurance program than you are with Delta Dental in many states. Allegedly. Don't sue me. So here's what I would do if I was in that situation. And I'm just going to give you step by step, okay? So step 1, I would learn how to market. I wouldn't rely on insurance. And why is this so important? Well, insurance is simply just marketing paid on the back end. That's all. Remember Groupons when those came out? Those were interesting. Groupons would come out. You don't pay for anything, but you had to discount all of your services to a ridiculous level. And then people would end up coming in and getting those services done. And it didn't really work out. Groupons, I don't even think anybody uses Groupon, or very few people use Groupon anymore. Insurance is even worse. So you're not paying for these people to come in and use you. You are just discounting services in a major way on the back end. So basically what you're doing by being in network with insurance is you're marketing. You're just paying for it on the back end. And that works great for some people. I'm not knocking it. I'm not saying this is for everybody, okay? I'm just saying what I would do. So what I would do, the first thing is I would start marketing. I would learn how to market and attract patients to my office, and I would pay for that up front rather than on the back end. That would be number 1. Number 2, I'd work with training my team to improve the patient journey and my TC and doctors on how to present treatment to the patient, not the insurance. What do I mean by that? A lot of times you can get away with a lot of things when you're in network with insurances, especially if you're one of the few doctors in network with insurances in your area, or a small group of doctors, and there's a long waiting line. I just saw this recently where a doc was with Delta Dental. Their average time to appointment was 40 days. They dropped Delta Dental. They're trying to get marketing patients in, but the marketing patients aren't coming in because they have them waiting 40 days. Delta Dental patients will wait 40 days, but like a regular patient who just wants to get in and be seen will not wait 40 days. And so you have to improve your patient journey. It has to be a lot smoother. You have to answer the phones. You have to answer questions on the phones. Your team has to be nice. And then when you present treatment, you can't just present the treatment that insurance is going to cover. A lot of doctors do that. They don't actually treat the patient. They just treat the insurance. And that is a big problem. It's not good for the patient. It's not good for the office. It's not good for the doctor either. And so you have to learn how to do those things properly. And you have to smooth all that out so the patient journey is smooth from beginning to end. That's going to allow you to get more of the marketing patients in. Number 3, I'd increase capacity for marketing patients by letting all my patients know that I'm no longer a network. And I would do that one by one. So I'd figure out which plans are the biggest, meaning representing the most amount of people and the most amount of production or collections. And then I would stack them, and I would start with the smaller plans, the plans that aren't going to hurt me as much. And I would keep any plans that were reimbursing me what my rates are. Those are fine. I don't care about those. I'm just going to go to the plans that are not reimbursing me well and that are smaller. And I'm going to do them one by one. As I do that, I'm going to, at the same time, ratchet up marketing. So I'm going to ratchet down, get rid of the patients or allow the patients to leave. Hey, we're no longer a network. That's okay. They're going to leave. And then I'm going to ratchet up marketing to fill that capacity. And this is the scary part. Okay, this is the scary part. And then number 4, I'd introduce patient financing and offer monthly payments to every patient. The reason I would do that is now I'm going to do more treatment. Every office that I've seen do this sees a 30% increase in their patient acceptance. I'm sorry, collections. Okay, 30%. 30% minimum. I've seen people do 100%, but a 30% increase is a minimum when you start leading with monthly payments. So the patient comes in, they need $2,000 worth of treatment. I'm going to lead with, hey, we can get this done today for $200 a month. The reason this is so valuable, outside of more people say yes, is that it also avoids the insurance conversation. So what you're going to do is you're going to figure out what's going on with their insurance. You're going to ballpark it. You're going to lowball. So that way, if anything, you're going to give them back money. You're going to give the patient back money, if anything. It's better to surprise patients, right? And you're going to give it back to them at the worst case scenario, or it's going to wash even. And now insurance isn't even a conversation. We're talking about monthly payments. That's huge. Okay. Then I would implement AI wherever I could for the team so I could reduce my costs and reduce my labor and increase my customer service, because now the people in my office are focused on the patients that are there. And so I would use AI for showing treatment, so that way I could build more trust. Like, hey, this isn't just me saying this. Look at what the AI says. I would also implement AI to answer my phones, answer all of my new patient calls, because it's going to convert better than my front desk. That'd be the bare minimum that I would do right now with that. And that would be my 5 steps. If you do those 5 things, you can get out of network with insurances if you want. Not everybody wants to get out of network. Now, I have a very in-depth, like 2-hour program that we did with CE. It's free. And if you want it, I can give it to you. Doesn't cost you anything, a little bit of your time. You get some CE credit with it as well. All you have to do is comment down below wherever you're watching. If you're on Facebook, YouTube, wherever you're watching, watch this and comment, and I will get that to you. 100% for free, no strings attached. And hopefully this is helpful to you. All right. You guys have a great day. Thanks so much for tuning in. And hopefully I can do my podcast every day this week and stay healthy. All right. Take care.